The following portion of Mass Appeal is sponsored by the American Association of Endodontists.
As the weather begins to warm, we find ourselves more active and the spring sports start to ramp up. That's why now is a good time to remember to think about your oral health. Whether you find yourself with a sports-related injury or just a simple toothache, an endodontist can be your greatest ally. Dr. Craig Hirschberg joins me now to talk more about oral health. Good morning, doctor. Welcome to the show.
Morning, Patrick. Thanks for having me.
So why is now a good time to remind us and our viewers about the field of endodontics?
Well, it's becoming spring and, it sends people outside and people are doing outdoor sports. And it's a good time to remind people that sports-related injuries can have a negative effect on your teeth.
So let me ask you the question, because I have it and I'm sure our viewers do too. What's the difference between endodontists and my regular dentist?
Well, an endodontist is a dental specialist who's had a minimum of 2 years of additional training in advanced endodontic techniques, and root canal treatment is an endodontic technique, and advanced pain control. In addition to that, endodontic practices are set up in a manner that enables them to see patients who are experiencing tooth pain or other dental emergencies on very short order.
Now, I understand that, springtime, we think about our sports, but, hockey players, field hockey players, soccer players, all have teeth that are at risk. And your organization really stresses the importance of saving your original teeth. Why is it important for people to save their natural teeth?
Well, nothing functions like your natural teeth. Nothing's going to look like your natural teeth. And given a choice between saving a natural tooth with root canal treatment or extracting the tooth, I would highly recommend that people save their tooth. And even though dental implants can be a great replacement for a missing tooth, it's not a substitute for an existing tooth.
You mentioned root canals a moment ago. I personally have never had one. I don't know what the experience is like.
I have.
Explain it to me.
I'm sorry, what was the question?
Explain the process of a root canal and maybe some of the misconceptions that most people have about them.
Well, root canal treatment essentially is cleaning out the interior of the tooth and sealing it so, to prevent infection in the future. And the biggest misconception about root canal treatment is that it's a painful procedure. The majority of my patients would get up out of the chair and ask, what is all the fuss about? It's rarely a painful procedure, and it's more likely to relieve pain than it is to cause pain. It may sound a little simplistic, but this is not your grandma's root canal. So.
Yeah, it's not like it was 20, 30, 40, 50 years ago, like, as you mentioned, like our parents and grandparents experienced. So what are some of your tips for our audience and myself to make sure we keep our natural teeth healthy this spring?
Well, if you're playing contact sports, it always helps to have some type of mouth guard. In general, it's important that you go for regular dental checkups. The usual recommended interval is every 6 months, that you have regular cleanings and that you have as good of oral hygiene as possible, which is toothbrushing and flossing, which should be done on a daily or multiple time daily basis.
This has been an absolutely fascinating conversation, and I could go on for about another hour with you. But if our viewers want more information, where can they go to learn more?
So if people want more information, they could go on to AAE.org, and on our website, we have an entire area that is meant to give patients information on endodontic treatment and general dental care. If you find that you are having a toothache or you've just sustained dental trauma, or you're, taking care of somebody that has, and you want to go directly to an endodontist, you can go to findmyendodontist.com, and that is a great referral database for people to utilize.
Fantastic. Dr. Hirschberg, I want to thank you so very much for educating us about your field and the difference between what you do and what my regular dentist does. Good seeing you.
Good seeing you too. Thanks, Patrick. Take care.
The preceding portion of Mass Appeal was sponsored by the American Association of Endodontists. For more information, visit findmeendodontist.com.